cybercriminals are starting to target the healthcare industry.
Major trouble and serious financial consequences for hospitals, doctors, and patients around the country.
This morning, healthcare professionals in several states tell CNN they're still dealing with the fallout from a major cyber attack.
Cybercriminals are actively targeting the healthcare sector.
The Department of Health and Human Services faces persistent cybersecurity threats that exacerbate the challenges associated with data and technologies used to carry out the department's vital health and human service missions.
With the increase in the use of technology and more digital information, there are increased opportunities for bad actors to gain access to patient information, disrupt healthcare services, and steal funds.
Healthcare fraud is not a victimless crime. It affects everyone, individuals and businesses alike, and causes tens of billions of dollars in losses each year.
Fraudsters look to exploit their systems for personal gain. External threats to the confidentiality, integrity, and availability of HHS systems and data are persistent and growing.
That's why here at the Department of Health and Human Services, we are committed to continuously enhancing our cybersecurity measures to protect vital healthcare data from emerging threats.
Our cybersecurity work focuses on making recommendations to strengthen the IT systems that support programs that provide our fellow Americans with critical benefits, such as Medicare and Medicaid coverage.
This will allow us to identify gaps in security and provide actionable recommendations to address the vulnerabilities identified.
Some of our key accomplishments include implementing penetration testing and cybersecurity threat audits, which help uncover active threats and security gaps within an organization.
We simulate a cyber attack as if we were a hacker. What this does, rather than just simply review documentation, is to actually knock at the door, if you will, to determine whether the door is locked, and if the lock is there, how good is the lock, so that we will know whether or not the auditee has implemented controls that would prevent access, and if access is not prevented, would detect it.
The work we do every day at HHS-OIG impacts Americans by protecting personal and health information, preventing financial loss, and promoting confidence in the healthcare system.